Hi there, my name's Stuart. I'm one of the neurology physiotherapists from NHS Tayside. Today I'm going to do a little video just to talk about foot drop that affects a few conditions that we see, namely stroke and MS are the most common ones. It kind of comes in two different forms. It can either be a completely floppy foot that you can't physically lift your toes or lift your ankle up towards you, which is a kind of true drop foot, or you can get what's called fatigable drop foot, which is essentially you might start okay when you're walking, but the further the distance you go, the more your leg fatigues, and then that's when the foot just starts to not lift quite as well, and that's when the toes start to maybe catch on the floor, you start to scuff your foot a little bit, and that's more a fatigue issue in the ankle. They both kind of have similar issues. The main issues are your front of your ankle, so your dorsiflexor muscles, your tibialis anterior muscles, just don't get a strong enough signal anymore from your condition. So essentially you don't have the strong enough signal to give that muscle the strength to pull the ankle up. But that's also combated by a tightening of the calf. So if you're not able to bend this up, your calf muscles tend to shorten at the back, and then that means that both you don't have the strength to lift up, but then physically you don't have the range of movement because of the tight calf as well. The easiest way to tell if you've got a tight calf that's affecting it as well and not just a pure weakness is just simply flipping a towel around the bottom of your foot, pulling it up, and you can compare it with your other foot. If it doesn't bend up the same angle as the other foot, it's likely you've got a bit of tightness in your calf also impacting that movement as well. So today we're going to show a few different stretches to do to help stretch that calf out and make it a bit more amenable to exercise, and then a few different strengthening exercises to hopefully target the front of the shin to help get that ankle moving a wee bit better. The key is with any of these exercises and with your walking, if you have fatigable drop foot, the worst thing you can do when you're walking is try and power through that drop foot. You're not going to, if that's fatigued, you're not going to be able to power through and improve. So you're best just to have a little rest, have a seat somewhere, sit on a bench, let that ankle recover for a few minutes and then see if you can go again. But I'll show you these stretches, give them a go and see how we get on. So first up, we're going to show you some basic stretches to help stretch the calf muscles that can be very tight in these conditions. First one, all you need, if you do have an exercise step, happy days. If not, all you need is your bottom step of the house. Even just a thick boot can sometimes be enough depending on the range of your ankle movement when you're doing the exercises. And all you're going to do is step up. Important to say, if you do have balance issues with your condition, always have support. So it's ideal if you're at the stairs, you've got a banister to lean on. And all you're doing is balls of your feet on the step with the heels hanging off, and you're just going to sink the heels down and stretch the back of the calves. You might feel, if you do have a condition that you're a bit tighter on one side, you might feel that one side doesn't go down enough. So you're just stretching the more severe the tighter side, you're stretching that first, and then you could even start to bring that leg out the way and stretch the other side to get down that little bit further. And all you'd hold in that position for starting off 30 seconds, seeing if you can build up to a minute if it feels comfortable enough, and repeating minimum 3 times a day. Depending on your type of condition and how much spasticity and tightness affects you, you might want to do it regularly throughout the day. 3 times a day might be enough depending on how you get on. And as you're doing the exercise, you just want to see if you're feeling comfortable there, can you start to sink the heels a little bit more, and just try and challenge yourself to stretch it as time goes on. You shouldn't get any pain when you're doing the exercise, so if you're getting pain, just come up a little bit, and you just want to find that comfortable stretch and sit there and see how you get on. Second stretch is another one just to tackle the gastrocnemius muscle in the back of your calf, which is the big kind of bulky muscle you see in your calf. If you have balance problems, just make sure you do it beside support, so your kitchen unit or somewhere is ideal, or alternatively your hands can be against the wall or somewhere just to keep your balance. And all you're going to do is you're going to have the affected leg behind you with the foot flat on the ground, toes facing forward, stepping the other leg forward far enough that you've got a good bit of distance between your feet, but not so far that the back heel starts to come off the ground. So you want both feet planted, and then all you're going to do is back leg stays straight, front leg bends, and you're essentially just trying to bend that ankle movement down a little bit. Make sure you keep the rest of your body up nice and tall, so your hips forward, shoulders tight, head up nice and tall, and then sit and hold there for around about 30 seconds. Build up to a minute if you can, And again, depending on your condition, 3 sets might be enough. You might need to do it a bit more often than that just to get that regular relief throughout the day. Your next one is to tackle the soleus muscle. So this is a kind of a tighter band muscle that goes down inside the gastrocnemius muscle in the back of your calf. Can be quite tight. Sometimes your gastrocnemius might not feel too bad, but this soleus muscle might be the tight thing, so you just need to try the different stretches. It's beneficial to do them all just to make sure you're maintaining your mobility around your ankle, but you can experiment and see what one is especially tight and maybe work that one a little bit more. All you do with this one is the affected foot slightly behind you, so not as far as the last exercise. So you've got a little bit of space between your feet, and all you're doing this time is you're bending both knees. So you're doing a kind of mini squat down. Again, if you need support, use it. We're not working on the balance here, it's more the stretch. And all you're trying to do is trying to make that ankle tighter or narrower. You want the heel to stay planted the entire time, and then you're just sitting down there. Again, find your comfort zone, don't push into pain. You want a good stretch, but nothing too uncomfortable. Hold there for about 30 seconds, build up to a minute if you feel comfortable. 3 sets minimum. Depending on your condition, you might need to do a bit more. Exercise is just a bit of a mobility drill for your ankle, for your foot, and just to encourage a bit more of a normal walking pattern when you're pottering about. And all you're going to do with this one is, we're going to do both sides anyway. First one is you're going to have your affected foot out in front of you, and all you're doing is essentially you're stepping forward with the heel down, stepping back with the toes down, and you're just going back and forth. If balance is an issue, again, you can hold on to a bit of hand support as you work back and forth, and you just want that ankle to be bending forward as you go forward, going back as you go back, and you'll do it around about 20 times back and forth with one foot, and it's just trying to normalise that gait pattern, that walking pattern, that gait pattern with that ankle. And then what you'll do, you would swap over once you've done your 20 and just do the exact same with that affected foot. So you might have to think a bit more on this side about how you pull your toes up. Just need to focus a bit more on making sure that heel comes down at the front, toes come down at the back, and you're just practicing over and over again. If it feels easy, seeing if you can put a bit of momentum behind it and just try and speed up as you go. And it's just trying to train into your brain that normal movement pattern. And then you can start to build this into your normal walking as you go as well. Going out a walk, try and spend a bit of time thinking about what your foot's doing as you're walking. Heel comes down first, and then you roll off onto your toes. And give it a try 20 times on that side as well, and see how you go. Hold up till a belt, just something that you've got a bit of tension to pull on, and you're basically going to pop it around the front of your foot on the ball of your foot. And all you're doing is you're pushing your foot away, and then you're trying to pull your toes up towards you as best you can. You might not have much movement there, and the till's just using it to assist up and down. And you literally just go push away and pull up, doing about 10 repetitions at first. If you can, build up to about 20 repetitions, and then you'd be repeating it about three times a day if you can, just up and down like that. And you purely base it off the strength you have in your ankle. If you've got not much going on at all, your arms are doing a bit more. If you do have a bit of strength in the ankle, basically just see, can your ankle do as much as it can itself? And these arms are just helping do that little bit extra push up and down with that one. The next exercise, there's 2 versions of this depending on how tight and how stiff and how mobile your ankle is. The easy version of it is just simply pushing the foot away and bending the ankle up. So you're getting the ankle to do a bit more itself without that physical assistance of the first exercise. You're just going slowly down and pulling up towards you. Again, a good few repetitions, about 10 to 20 repetitions. Aiming to do a minimum about 3 times a day if you can, down and up like that. If that feels easy, if you can do that, not too bother. If you can get about 20 repetitions with not too much of an issue, you can make it a bit harder by basically adding the opposite foot. So you're essentially, as you're pulling up, this foot's applying a bit of a resistance to the movement. You still want the foot to do the full movement, but you just want to apply that bit of pressure, so it's essentially pushing against a resistance. And you can do same again, starting with about 10 repetitions up and down. And you can, if you want to make it even harder, you can start to increase how long you hold it for. So you pull your foot up, hold for 5 to 10 seconds and down, and see if you can build up to the 20 repetitions again with that as well. Your next exercise is just a bit of a movement of the big toe. So as well as the ankle physically moving up and down, your big toe plays a part of it as well in your ability to control that ankle. So all you're doing from here is just with the foot flat on the ground, You're trying to either lift all your toes or just that big toe if you've got the ability, and you're literally just going up and down again 10 to 20 times, just try to move that toe as best you can. You can start to experiment a bit if you don't have that ability. If you can reach, you can either use your hand just to give that bit of assistance up and down, or you can put something around your foot, a band or something, just to assist with that movement. But again, you want the toe to do as much of the movement as you can, and you're just providing that little bit of assistance up and down with the movement as well. If it's very, very weak, you can start to slow down the lowering down of the foot and then pulling up, and that just means the muscle's working just in a different direction, so it is working to try and control the movement down, and then you can just give it a pull up as well. And you do same again, about 10 to 20 repetitions, 3 sets a day with that one as well. And then the final strengthening exercise is just a bit of foot mobility as well. It can be very common with these conditions to have quite a rigid foot, so you're walking with a bit more of a lead foot as it's coming down, bit heavier down. So it's more the intrinsic muscles of your foot that you need to work. So all you do with this one is foot on a towel, and you're just trying to scrunch that towel with your toes and then straighten the towel back out again. And you're just the towel's providing that bit of resistance against your foot as you stretch up and down. And you can start to experiment as well. If you can do about 10 to 20 repetitions here with no issue, you can start to hold that squeeze, so hold for 5 to 10 seconds with each repetition, just to make it a little bit harder again. So that's a little exercise routine we've got for you today, just to try and help that ankle move a little bit better. The important thing is with neurological conditions, you're not going to see a quick fix with these things. It's not going to be something you see within the first week or days. You need to try it for a bit longer, going into a couple of months. If time goes by and you still feel the ankle isn't improving, you're still catching your foot, you're still not able to lift the foot very well, it's worth chatting to either your physiotherapist or your GP, depending on who you're involved with. Potentially a referral to orthotics might be a benefit, who can provide you with splints and support, just that it can provide a bit more of a physical support to help you move a bit better and to help the ankle move a bit better as well.